Hi, Paul Sackis, Good News Broadcast, speaking to Dr. Norman Chip Harbaugh. Hi, Doctor. How are you?
Doing good, Paul. We're doing good.
Good. I hope I said your last name correctly.
That's close enough.
It is? All right. You're a MD, right?
Yes,
as well as a FAAP. What's FAAP mean?
It's a fellow of the American Academy of Pediatrics, so just plain English, I'm a pediatrician that practices full-time.
Okay, good. You like those kids?
I sure do. I love them.
All righty. What brought you to do that? Why are you involved with working with kids?
Well, if you want the story, the quick version.
Yeah.
When
I would like the long one, but we probably don't have time. We'll do that next time.
I had to do a lot of rotations with adults, and you'd tune them up with all their meds, and you'd send them out, and about 6 weeks later, they'd come through the emergency room with everything wrong with them that you had just cured, and they hadn't gotten their medicines, and they had a carton of cigarettes, and I said, I thought you need to take your medicines. Well, I need the cigarettes, but I don't need the medicine. So you go to kids, they don't make themselves sick. They are great. You can be a role model. You can affect their lives. It's like being a teacher. You can affect society for years to come. So if you can save for a child or just be a role model, I can't figure a better way to serve my life.
Okay, great. And you were actually also CEO and chairman of the board for Kids First Pediatric Alliance, serving 700,000 kids over down in Atlanta as well, right? That's a great thing. We'd like to learn more about that at another moment as well. But right now, we're going to talk about flu and flu season, and we've actually did a few interviews already on this subject. One with some parents, actually quite a few, with parents that lost their children as a result of them getting the flu and not having flu shots. So this is a serious subject, and there's some serious numbers related to it. So have we learned more things?
We have, and first of all, my heart goes out to those parents. I think you probably bring up, it's a great segue in the fact that flu is sort of never given its just due on the fact of how big a killer it is. Mm-hmm. The statistics, as you probably have seen, 36,000 people die each year in the United States alone from the flu. One thing you already mentioned is even sadder is 80 to 150 children die each year in the United States. And you may say, well, those kids have some disease. No, half of those were healthy, normal children. So it is a killer, and we as a society take it for granted.
Okay. So what have changes have happened right now? I mean, we know more, and there's flu shots.
Well, we have flu vaccines, and probably the biggest change is the CDC, which is the Center for Disease Control, came out with recommendations. First of all, the old recommendations for children were supposed to get vaccinated between 6 months of age and 5 years of age. But the changes you mentioned, now it's recommended from 6 months of age all the way to 18 years of age is the vaccine. The other thing is, what have we learned? We've learned, how do we prevent the flu? Well, society thinks that, the best way to do that is, washing hands, getting the right amount of sleep, eating a healthy diet, avoiding people who are sick, and probably even taking vitamins. They rank the flu vaccine below all of those. Where, in contrast, the Center for Disease Control recommends the number one thing to prevent the flu is flu vaccine, as you already mentioned.
Can somebody get the flu by taking the flu vaccine?
That's funny that you mentioned that, because that's probably one of the biggest myths or wise tales. You cannot get the flu from the flu vaccine, either the flu shot or the flu mist. However, I think what happens is, the theory is, you go into a physician's office, hospital, pharmacy, whatever, get the flu vaccine, but then other people are there, and this time of year, flu is going around along with colds, you pick up a cold from that environment. You go home, and you get a cold. Now, how can you tell? Remember, a cold, if you get it, it's going to last probably 2, maybe 3 days, 5 at the most. The flu, if you got the flu, you'd be flat on your back for a week and can't move. So most people get the colds from the environment of which they're getting the flu vaccine.
Medically, what's the difference between a cold and a flu?
Probably the severity of illness. Both are caused by viruses. Both sort of give you similar symptoms. Sore throat, headache, stomach ache. The flu, though, probably does give you a lot more body aches, usually up in the upper arms and the thighs. And the big difference is, if you have a cold, you'll feel a little under the weather, probably can still function. The flu, just imagine you're stepping out of the curb and get hit by a bus. Get flat on the back, lethargy, cannot move, and you're out of work for a week.
And is it quick? Is it, in other words, so it's day one, you don't know whether you have the cold or the flu, or do you know that you have the cold or the flu?
You might have a suspicion that you have a virus coming on, but you really won't know until probably early. Now, if you get hit and just are flat on the bed and can't move and aches, you probably have the flu. If you're starting to feel a little sore throat and scratchiness, you're right. It's sort of too early to see.
So what is it, once again, medically? I mean, do you get more virus in your genes? Or what actually is literally happening to give you the flu as opposed to the cold?
It's actually a different virus. There's influenza A and influenza B, so
All
it's much more potent. So it's like a virus on steroids.
Okay. All right, very good.
It's also much more of a killer.
In addition to the flu shot, what is recommended? One for, let's stick with the flu. What do you do to get yourself back into shape?
Except for the flu shot, how to get back? Well,
yes.
Pretty much there are some antivirals out there that you can take, and then sometimes they're recommended, sometimes they're not. They can take the edge off of it, decreasing the length of illness by about a day or two. It's somewhat controversial there because sometimes we may perceive that there increased resistance to those drugs, and we'd not like to try to overuse them. But pretty much once you have it, it's just rest and time that's going to get you over it. But the sad thing is, not only are you going to get it, but who else? Your family will get it. And this is why we're trying to immunize children, because the 6-month to 18-year-olds, that's where the disease resides. They go to school, they go to daycare. Their hands are in their mouth and noses. They don't wash them. They come home, then what do? They give it to you. They give it to their family. Holiday season, Thanksgiving, Christmas, Hanukkah, all those, they're going to spread it around, not only spread their love, but they're going to spread all their germs and spread the flu.
Chip, that's why I always tell my parents, I don't want to go to school. That place you could get sick.
It is. It's a disease ground. But if you want to be able to open your presents for the holidays, get the flu vaccine. Washing your hands is good, but man, you got to go to school. Nice try to get out of it.
You got to try whatever you can, You got
it.
Now, one other question. So, and the parents, I know you said until 17, but all right. So now you're you're in your 30s and you have a 2, 3, 4-year-old or whatever, and you get the flu. Your 2, 3-year-old can get it just like they could get it in school, right?
Exactly, and that's why everyone would be, ideally, if everyone in society, of course with limited resources, we sort of targeted both high-risk individuals with asthma, diabetes, and such, and the elderly and the pediatric population. But ideally, we'd love everyone to get it, because you're right. If you want to look at the family, say there are 3 or 4 or 5 people, if 1 or 2 get the vaccine, you still have 3 people out in society getting exposed, and once they get it, where are they going to bring it? They're going to bring it home to you. I had it the other day in my office, had a dad tested positive for the flu just 2 days ago. Kids came in with a little cold, tested them for flu, negative. Reason is they had the flu vaccine.
I'm sorry.
Go ahead.
Who's MedImmune? Did I read that right?
Yes, MedImmune. There are a number of makers of the flu vaccine. You have the flu shot and the flu mist. MedImmune makes the flu mist.
Okay. What do you mean a flu mist? I'm a shot guy. What is a mist?
Well, yeah, I'm glad you're a shot guy, because as a pediatrician, we'd love to see you. We don't have to chase you around the office.
Well, I'm very scared, though, of the shot, so I do run around. No, go on. I'm sorry.
No, one of the biggest fears, you're right, is in the past, the barriers for getting the flu vaccine. People thought they're going to get sick, as you mentioned. They feel they're healthy and they don't need it. And the other big one is fear of needles. Well, now with the flu mist, you don't have to, there's no excuses anymore. So what the mist is like just a nasal spray. A little spray, one in each nostril, and you're protected against the flu. And the good news is it's anywhere from age 2 to 49 years of age can get the flu mist.
Interesting. And you put your head back when you do this kind of thing?
No, just put your head forward, spray it there. You don't have to sniff in, and it's pretty much as easy.
Really?
Yes.
Why do I always think whenever I had to do those nasal things, I'd have to put my head back, and then it would go into my throat. Is that no more?
Well, now, what you're talking about probably is if you have allergies and you have nasal sprays.
Yeah, that's what I used to do.
And that's a fairly heavy dose of mist or volume that's going up. The good news with the flu mist is if you spray it, look at the mist, and it's only 0.1 cc, so it's a very, very small amount, so it's not going to have much drip. You really won't even know you had anything in there.
And it does the trick just like the shot, equal?
Well, it depends. Different surveys and studies show different things, but in children, a lot of the studies have shown that the mist actually is equal to, but in most studies shows it's probably about twice as good as the shot, which is
really?
Kids' dream.
Great. Okay. I love it. Perfect. All right. Well, obviously, you know your stuff. You're down in that Atlanta area yourself?
Yes, we are. We're a little cold down here, so that's why we're trying to get the message out. If you get your flu vaccines now, help prevent it from in the future.
I'm still chattering up here in New York from my teeth.
I'm flying up there in just about an hour and a half to come see you.
Long underwear.
I'll bring the long coat.
There you go. Okay, Chip, nice speaking with you.
Well, Paul, thank you for getting us, help us get the message out.
Give me a call when you're in town and if you need anything.
You'll take me to dinner?
Give me a call. Yeah, that's cool.
Take care, Paul.
All righty, take care.
All right, bye-bye.
Bye-bye.